Hello! So this is the video about the miscellaneous. This is what I would call it, basically. So it's a little bit about the right before, the days after, and the results. And I think the results is gonna be, I hope, not too controversial for you. So the before, I was told the morning of not to eat, to limit my drinking to only sips of water for the medication that I needed to take in the morning. This is all because of the possibility of needing to be intubated. There's actually no need for you to avoid eating or drinking before a spinal tap. I am by no means am I giving you a green card to eat or drink. You need to follow what your hospital and your doctor and the protocol that is set for you. By all means, I am just explaining the reasons. The reasons that you are asked not to eat is because in any procedure that is done at any hospital, they are always guarding of the possibility of anything that could happen. And what if on the table, out of the blue, you have, not that something might have, not that because of what they're doing something happens, but what if you have, just like at any time of the day, crossing the street, something happens to you, you have an epileptic attack or anything else, and they have to intubate you. Well, the easiest way to intubate a person is always if they have not eaten, because it's the easiest pathway, clear pathway down. So, and hence they ask you not to eat. But I want to rest you assured that there is no reason why you can't eat, in the sense that there is nothing that is going to happen in the hospital that day that requires you not to eat. I'm not saying that you go ahead and eat. I am saying that do not worry. There is nothing that they need there's nothing that they need this area for. The same reason why most times they actually put in a port for an IV. It is just an in case. Sometimes they even connect an IV and give you some fluids. It's just an in case. It's really not something that is technically needed. And I guess this is as far as I know. This is what I've always been told, and I'm extremely inquisitive, so I ask all these questions, and I've never known there to be any case of that truly being needed. I could be taught differently, and then I will let you know, believe me. So I also wanted to talk about the after. The after, I have always been told, do not shower and don't take the Band-Aid off your back for at least 24 hours. Some places will tell you longer. You can take the Band-Aid off after 24 hours. I tend to leave it longer. I have an allergy to latex and adhesives, so that's always a concern. I want to make sure that they put nothing on me that has latex. That's I always watch out, that I don't end up with hives in my back or anything like that. And they also say they recommend you don't take any baths, or you don't submerge that area in any type of water, obviously pools, ocean, or anything like that, for at least 48 hours. And again, I like to extend that amount of time. And I'll give you a case. I had an LP shunt put in at one point, and believe it or not, 3 weeks, I believe it was 3 weeks, I have to go back in my notes, but I believe it was 3 weeks later, I stitched open, and CSF fluid started coming out from my back. So things do happen. I mean, that was a complete fluke. And in fact, I called the doctor, and the nurse said, "I'm sorry, you must be mistaken." And my answer was, I've had too many of these surgeries to be mistaken. And why don't I come in and you check it out for yourself? And of course, I wasn't mistaken, but these things are flukes. I'd rather be on the safe side, but at least follow what the guidelines the hospital gives you. As I have mentioned, there are hospitals that keep you overnight. The reason for keeping you overnight, again, is not a safety issue. It's because they're trying to avoid the needing of a blood patch. So they want to make sure that they monitor you, so they make you stay flat, completely flat. You can do that at home, but you have to be highly, highly disciplined. The minute that you get a really bad headache, lay flat. I mean, I've had friends that call me and say, I'm having this headache, why? Honestly, there is no cure for a low pressure headache. Low pressure headaches are awful. They're horrendously awful. I can't even explain how bad they are, and I'll do a video about it sometime. Honestly, there is no cure for them. There is no medication you can take for a low pressure headache except laying down. So lastly, I wanted to talk about results, and what I mean by that is usually your interventional radiologist will send your CSF fluid to the lab, and it will be tested. If the fluid is clear, and I always ask, that's a really good sign, because if it was cloudy, it's usually a sign of some kind of infection. That's usually one of the first signs they look at, if not the first sign they look at, to see if you have meningitis. As they do a spinal tap, and if it's cloudy, then that's a telltale sign of an infection. So that's the first thing I ask, is when the fluid is starting to come out, is it, what's my opening pressure? Next question, is it clear? And when I hear yes, and I go perfect, even though I was pretty sure. So they send and they test for protein levels and other levels in the fluid, which is always good to know. With intracranial idiopathic intracranial hypertension patients, usually the levels are normal, but it's good for you to know what they are, and it's good for you to know spinal tap to spinal tap whether they vary tremendously or not. That would be a good thing to watch out for, even though I'm sure your doctor does. So what I also would like to talk about in the results is, what is the usual standard? Again, please check this with your doctor, your neurologist. Now, I've heard the numbers when I talk to people, read about things. The numbers vary. I am really not sure why they vary so much. The medical standard is, as far as I understand it, 8 to 10 is the normal amount of CSF fluid a person has, a normal person without a headache that's walking around. Once you get to 15, that's sort of the top limit of what a person carries around. If you get to 20, we know that a person is probably not functioning in a normal range. And a doctor at that point should be aware or concerned that something may be malfunctioning. And once a person hits 25, that is definitely a number where we call that a condition, where we say that there is a problem. Many doctors say if you are 24.5, you're not sick. If you are 25.5, now you are sick. Please be aware that if you breathe deeply or if you cough, you could go from 23 to 26. So the ranges can vary dramatically. If you have a spinal tap in the morning versus the afternoon, the ranges can vary dramatically. And by dramatically, I'm talking, I don't know the exact range, depends on the person, but I'm talking, 3 points, 5 points, even 7 points. So when people talk about my opening pressure was, I've heard of somebody having a 60, which for me, I've had close to 40. That was, I believe, my highest. Not quite, but close to. If somebody like me had close to 40 and I was double my weight, the weight that I am presently, if now my opening pressure is over 25 at this tiny weight, we know there's still a problem. So you have to not only look at that as a symptom, that is definitely a symptom, but you have to look at the myriad. And don't ever forget that in idiopathic intracranial hypertension, your eyes are the biggest clue. So you have to look at the vision. Unfortunately, I'm already blind in one eye. But you also, do you have tinnitus? Do you have headaches? You have... So you have to look at the person as a whole and see what the other symptoms are. And I think that really truly makes the wisest diagnosis. Since we are talking about lumbar puncture, I did want to bring up the numbers in that sense. Somebody could have very low numbers and still have intracranial hypertension. Intracranial hypertension. This is what happens. Right? A person can have a very high pressure and be walking around just fine. So it really depends on the whole body. So that's sort of my little grain of salt about results for lumbar punctures. Again, don't forget, I'm not a doctor. I've only read a bit and experienced a whole bunch. I hope this has helped. If you have any questions or comments, please let me know. I answer them as much as I can. Please know it takes a lot out of me to do all of this, but I really, really want to. And I'm here walking the road and the path with you. Thank you.